Hi, this is Gene Ransom with MedChi, the Maryland State Medical Society, and we're going to start our review of the 2022 Maryland General Assembly healthcare issues with a discussion of Medicaid physician fees. I'll do a short series of videos on some healthcare legislation that was changed and laws that were enacted during the General Assembly session, and this is number one. So the Medicaid physician fee issue really has been an issue for MedChi and for Maryland physicians for several years now. And in fact, to kind of go through the background, it really started back when Obamacare was passed. Because when Obamacare was passed and Maryland implemented, the federal government gave extra money to the state, and they were able to pay physicians parity for office visits for primary care. The state actually decided to pay for all evaluation and management codes, which is all office visits, regardless of what specialty, for everyone. And that was the case for several years when the Obamacare funding came in. Now, when the funding from the federal government slowed, the state made a decision under the prior administration to gut Medicaid payments to physicians in 2015. And that troubling decision by the prior governor's administration has been hampering Medicaid recipients for nearly 9 years now, and it's been a major issue. So for those of you who don't remember, Medicare obviously is the government program for seniors. Medicaid is the program for folks who don't make as much money. And it has long been MedChi's position that payments for Medicare should be equal to payments for Medicaid. It doesn't make sense that we would treat one class of people different from the others or have a lower level of healthcare services for Medicaid patients than for Medicare patients. This cut that occurred under the prior governor's administration has been an issue that we have continually hammered the governor and the General Assembly on. We met with Governor Hogan right after his election, actually during the campaign and after his election, and he said that he was going to try to fix it and make it right, but he would need time to do it. And over the course of the last 8 years, he slowly has crept the money up by putting a few additional points in the budget here and there every single kind of year of his term. We've kind of tried to move in the right direction. And this year, in his budget, he actually put the full payment to bring it back to 100% for evaluation and management codes. MedChi would like to thank not only Governor Hogan for consistently moving this in the right direction and funding Medicaid physician payments, but also leaders in the General Assembly like Guy Gazzone, Maggie McIntosh, Krill Resnick, and others who really have fought hard and worked on this issue and been with us. In Maryland, the budget really does start with the governor. That was changed by a constitutional amendment, and next year it will be a significantly different dynamic in Annapolis. But under the current rules that we're in today, the governor really has the power of putting things in, and the General Assembly can only take out. In this case, the governor did put in the full fees, and the General Assembly did not take them out. So what does that mean? That means that starting July 1, the start of the 2023 fiscal budget for the state of Maryland, physician payments under Medicaid will be 100% or equal to Medicare for evaluation and management visits, which are most office visits for all specialties. It's a major change and a big difference. And for a lot of physicians, I think they're going to think maybe we need to participate in Medicaid. As always, if you have questions, you can follow us on Facebook or on Twitter at MedChi Updates. Our website has a plethora of information on health law and policy and other issues, and you can always reach out via email. Thank you for listening, and this is the beginning because we had a lot of health policy take effect this year, and we are going to go through it for you.